Nairobi, Kenya's capital city. It is a typical morning of a new day. The population of over 6 million people is awake. They traverse the city to Eka living. This is a replica action in other Kenyan cities and towns. Being one of the robust economies in Africa, Kenya is charging forward under an economic blueprint, Vision 2030. Kenya's population has increased more than 4 times since 1963, growing from 8.1 million at independence to more than 40 million in 2013, and is the 6th highest in sub-Saharan Africa, behind Tanzania, South Africa, the Democratic Republic of the Congo, Ethiopia, and Nigeria. This skyward population has brought with it many challenges facing Kenya's economic advancement, health being one of them. For more than 50 years, Pathfinder International has built successful approaches to delivering quality reproductive health and family planning services around the world. Pathfinder has provided training, technical assistance and support to a vast array of government and non-governmental partners in the provision of quality reproductive health and family planning care and HIV/AIDS prevention, treatment, care and support from the community to facility levels.
Afya Plus Nairobi Coast is a 5-year funded program by USAID, which is implemented by 5 strategic partners, namely Pathfinder, who is the prime partner. Then there's Child Fund, whose special focus is on orphans and vulnerable children. We also have CLUSA. This is another American organization with a major focus on looking at empowering families and communities in terms of economic livelihoods. NARESA is basically a clinical partner that had a major responsibility of ensuring clinical mentorship. Then last but not least, we also have PSI, and PSI's major focus was on behavioral prevention and also addressing issues of key populations in Nairobi. But it's also important to note that Afya Plus was not only being implemented by the 5 strategic partners that I've actually mentioned. We also worked with a number of local organizations, both CBOs, NGOs, and community units that had put formal structures in place that warranted us to be able to give them the much needed support.
Under the Kenyan Constitution, every person has the right to the highest attainable standard of health, which includes the right to healthcare services, including reproductive healthcare. Also, the Constitution under Section 53B states that every child has a right to basic and compulsory education. With family planning, parents and the government at large are able to plan for each and every child born. This will not only translate into healthy families, but also the government will be able to provide better services. A well-crafted reproductive health awareness by multi-stakeholders led by the government of Kenya and others, among them Pathfinder International, especially in the area of family planning, has been on for many years to help check the population growth and ensure quality life for all the citizens.
Kuna ile mila ya kusema kwamba ukizaa watoto wengi ndio kwamba ndio inatakikana tusijui ndio utajiri. Sasa hivi watu wameshajua kwamba mtu anatakana awe na watoto wale ambao anaweza kujimudu nao. Hiyo elimu wameshakuwa nayo sahihi.
I've been having a good challenge because many of these Morans have been beating their women because they have decided to take up their family planning without their consent. But when I go in, I chip in, try to educate them. They really understand because I'm their chief. They respect me. They can really hear what I'm telling them. That is how I ended up being a male champion. Yeah.
Siku ya leo tunaendeleza tu mazungumzo yetu ya kumhusisha mwanaume na upangaji wa uzazi. So huduma wakati uko na watoto wengi ambao hawajapangwa inakuwa ni shida. Badala ya kuwa na watoto 10 tuwe na 5, si ndio? Lakini waweze kuishi maisha mazuri, wasome kwa viwango ambavyo wataweza wao. Haya mambo yote yanayofanyika ni kwa sababu ya mama awe na afya bora, awe na afya nzuri.
Kwa hivyo nimekubali kupanga usafi ndio wale watu wangu napata maisha mzuri, alafu na elimu
In the traditional African setup, open talk on sex or sexual health was considered a taboo. But that is changing fast as communities are brought on board to seek the benefits of leaner families that they can cater for. At the center of helping communities to adopt best practices is Reproductive Health in Afya Plus Nairobi Coast program, working in delivering appropriate reproductive health interventions to the various communities there.
Kuna mhudumu wa afya alikuja kwangu akanielezea na nikafata maneno zake nikaenda. Tangu nianze upangaji wa uzazi, kwa nyumba langu ni furaha na niko na watoto ambao nitawalea kwa furaha, na wakati nitahitaji mtoto nitaweza pata.
We've been able to push on the empower the Mukuru community people. We've been able to clear most of the misconceptions in the community, because being a slum area, we have people from different walks of life. Many communities, they have their own misconceptions. So it's not all about children. It's not all about babies. Incorporate your husbands, tell them family planning, it belongs to all of us. And then in families, they've also had a time to, to live your life, because you're getting the number of children that you want. And according to the economic values, economic status that they've been having with family planning, they've been able to survive with the little money or the amount of money that they've been having, because the family is, let's say, manageable.
Afya Plus Nairobi Coast supported us with a cryotherapy machine and also reagents for screening of cervical cancer, and also personnel, both in the family planning and the clinic where the women goes for cervical screening. They've been supporting us with some contraceptives and also the personnel. So far we've seen a lot of good things happening to our mothers and also to the center.
Universities were also not left out. Afya Plus Nairobi Coast supported reproductive health and peer counseling at Kenyatta University to reduce the prevalence of sexually transmitted infections and HIV, as well as unintended pregnancies. Students receive reproductive health education and family planning guidance and counseling through peer-based activities.
Noting down abortion, pregnancy care, breast and cervical cancer awareness, contraceptives, and have to discuss issues of drug and substance abuse.
The Vice Chancellor of Kenyatta University has been very supportive of this program, and this is illustrated through her support financially in terms of sustaining the program. In the event that we don't have partners, the program still runs.
There were 10 school dropouts. Out of the 10 school dropouts, 9 of them were teens pregnancy. So we sat together as staff and said this is a challenge to us, and we actually tried to come up with ways on how to reach the youth. Afya Plus actually supported us training. They trained the 20 youth peer educators on leadership. They also trained them on RHFP, that is reproductive health and family planning. So after that, we realized that there was decline in pregnancy. That was very good. Then also we realized that most of them come and access this information on reproductive health and also get the pills.
When we came here, there was the number of pregnancies, of underage pregnancies, was very high. We had 6 pregnancies of students, especially students. So when we started to talk about how we can avoid getting pregnant. We taught the girls, and now the number of pregnancies have gone down.
Afya Plus Nairobi Coast, understanding too well that men still view family planning solely as a woman's responsibility, embarked on bringing them on board through education on their roles in effective family planning and the options available to them.
Ukifika pale vifaa vyote vile nakuonyesha liwezi mbaka.
Sasa hapa. Kwa hivyo hata mimi mwanaume ninapanga uzazi hapo unakuwa tunakaa.
wewe upange uzazi. Kwa uzuri zaidi wa kupanga uzazi, unatakiwa wewe na mke wako muende kwa daktari, mkasaidiane kufanya nini? Kuchagua njia ile ambayo unataka. Ndio nimesikia. Umeelewa vizuri?
Baada ya hiyo elimu, hiyo program kupita, nimegundua kwamba kuna umuhimu mkubwa sana mimi kuandamana na mke wangu twende kliniki. Na hivyo mpaka leo hii hiyo ndio nafanya. Wakati wa kliniki ukifika, huwa tunaandamana naye, tunakuja kliniki na tunapata elimu sote pamoja, na kama kuna masuala ya kujadiliana tunajadiliana pale pale na tunaelewana pamoja.
Afya Plus is unique in its country-led implementation strategy. The program works in close collaboration with ministries of health in each district to promote a coordinated approach and carry out activities at every level through county health offices, penetrating down to sub-county and community health facilities and reaching communities.
In our program, we've also looked at increasing the method mix, for example, so training and updating our health workers on contraceptive technology updates so that when clients come, they're educated on the full range of available methods, and the healthcare worker is able to provide the method of choice to the clients. And this has happened including for long-acting and permanent methods, where we have been able to train doctor-nurse teams to be able to provide bilateral tubal ligation, which is a permanent method. And we realized that there was quite a gap in this capacity, yet clients required these services. So we have built all this capacity over a period of time.
Kweli ni kichuma kidogo kama hivi. Unaona? Hiyo chuma inakaa kwenye kizazi chetu. Once hiyo ikikaa kwenye kizazi chako, haina madhara yote.
Na kwanza nilivyosikia kuhusu BTL, nilisikia na wazushi. Walikuwa wameongeza chumvi nyingi zaidi mpaka nikani kumuni. Lakini baada ya kuwa nimehamasishwa na kikundo vya shirika la Afya Plus, niliamua kuchukua jukumu niende nikafanywe mimi mwenyewe. Na nilipofika pale, nashukuru nilipokelewa vizuri. Na sio vile nilivyotarajia, maana yake nilitarajia ni upasuaji mkubwa ambao ni ulikuwa utanitia hofu. Lakini nilipofika pale, nilipokelewa vizuri. Nikapasuliwa tu mahali kidogo, nikafungwa vitanzi kwa ndani, nikiwa mimi mwenyewe nasikiza nikiwa niko macho. Tena nilikuwa naongea na wale madaktari ni story kuhusu kwangu nyumbani, vile ninavyoishi na matarajio yangu baada ya kuwa nimefanywa BTL na mume wangu. Baada ya kufanywa hiyo BTL, nilitembea mwenyewe kwa mguu mpaka kwangu nyumbani, na nilipofika nikapikia watoto wangu. Yaani sema nifanya kazi zangu za kawaida nyumbani. Na kama ni kuumwa, mimi si kuumwa. Mimi naambia wenzangu, yani napendekeza wenzangu tizia yule ambaye amefikisha ile namba yake ya watoto ile ambayo ameridhika nayo afanye BTL. Kwa sababu kama ukiniangalia kama mimi, mtu nikimwambia kama sijazaa, huenda akanikubalia. Kwa sababu niko mzuri, napendeza, nashukuru. Hata mume wangu pia unipongeza, kanambia mke wangu baada ya kufanywa BTL, umekuwa mzuri na mrembo zaidi. Sasa mtu akifanywa BTL sio kwa ati sijui ataumwa sana, sijui utakuwa ni mwili wako utarudi kama kawaida. Na utakuwa huna stress ati sijui leo sijui ninakosa dawa, leo sijui mume wangu sijui imekuwa kuaje, sijui mume wangu ni excuse kwa wewe unakuwa sawa tu na hedhi zako utakuwa unaona kama kawaida.
At the Nairobi and Mombasa county levels, Afya Plus Nairobi Coast complements service delivery with mechanisms such as trainings of community health extensionists and community health volunteers on many aspects of community health and also health management information systems. Family planning is an effective way of controlling fertility. Low fertility leads to a slower population growth. It has long been acknowledged as an effective public health intervention, highly cost-effective in decreasing maternal and child health burden of disease. In Kenya, according to Kenya Demographic Survey 2014, the use of modern contraceptive methods and the desire for smaller families has been on the increase, with a reduction in childbirth to 3.9 as at 2014 compared to 6.7 in 1989.
Wakati nilipokuja hapa kwa hii huduma ya family planning, nilikuja nikapata daktari akaweza kunielezea kuhusu njia nyingi za family planning, na mimi nilichagua hii ya 21 days ambayo niliona inanifaa. Wakati sikuwa naitumia, sikuwa ninaweza kuweka space kwa watoto, lakini saa hizi nimeona nimekawia bila kupata watoto.
Kuna hizi pills na kuna shindano.
Decades of research have demonstrated that modest investments in family planning has saved lives and dramatically improved maternal and child health, as well as improved socioeconomic status of the society in general. This is because it increases the per capita income of families, since they will be prioritizing the needs of their families.
Watoto wangu vile niliwapanga, nashukuru wanasoma vizuri, na nikiangalia kwa mara nyingi maisha yenyewe ni magumu, hakuna kazi za maana. Sasa ukisema watoto umewaweka na elimu yao ni hii, kwa kila mahali ni pesa, wangekuwa hawasome.
Ndivyo tumia hizo njia za kupanga uzazi, ile niliona inayonifaa. Nimepata mafanikio makubwa kwa sababu gap between mtoto wa pili na mtoto wa tatu, nilipata mimba akiwa na miaka 6. Between hapo, kwa kutoka kwa huo muda nilikuwa nimeshaweza kufanya maendeleo mengine, nifanya biashara zangu bila wasiwasi.
Hundreds of thousands of households are reaping from the broader sex education. Sex education assists families by teaching youth on how their reproductive systems function, how to use contraceptives, and the truth about pregnancy and birth control. On the other hand, natural family planning techniques help women and their sexual partners know how to chart fertility cycles. Couples can abstain from having sex or use a barrier protection method during fertile times to prevent pregnancies.
Saa nyingine unaenda mahali utakuta kuna session, wengine watakuelewa, wengine hawatakuelewa, haswa ya mambo ya matumizi ya condom. Utakuta watu wanakuambia, sasa wewe, mimi nitakuwa mtu ni bwanangu nitumie condom. Lakini kulingana na kuwa mtu tumejenga uzoefu, alafu ile mara kwa mara kule kufuatilia, utakuta yule ambaye alikuwa yukuuliza maswali atakuja kwa ofisi ahitaji hizo condom.
The large size of Kenya's young population and its rapid population growth are influenced by several factors that have serious consequences for the health and well-being of women and children and the development of Kenya. Some of these factors include early marriage and childbearing, unmet need for family planning, high total fertility rate. These factors increase the likelihood of unintended and unwanted pregnancy, unsafely performed abortion, high-risk births, and disease and death from pregnancy-related complications. On the other hand, the use of technology and short text message as a follow-up to family planning services offered has been described as taking information and communication technology (ICT) to the doors of clients and bridging the distance and time in service delivery.
Mimi natumia simu, na katika hii hali ya kutumia simu pia kazi zetu nyingi sana zimekuwa rahisi katika zile huduma zetu kule nyanjani.
The comrades also target off-campus activities as they target in and out of school youth. This program has strengthened the university's capacity to respond to their students' changing needs. Afya Plus, in conjunction with the Ministry of Health, also aimed at contributing to increased access to quality reproductive health services among female sex workers. Although Kenya has been long held as one of Africa's family planning successes, both in the use of contraceptives and other reproductive health services, there is still substantial unmet need. Ultimately, Pathfinder's decades of experience in supporting successful reproductive health and family planning services under the Afya Plus Nairobi Coast programs has proven that deep community involvement leading to local leadership, ownership and direction can attain better lives for Kenyans.